Good morning, and thank you very much for inviting Barbados to be part of these very critical discussions. So today I want to tell you what it has been like for a small island developing state like Barbados the last few months. A small, vulnerable economy, but one that also chaired the WHO Executive Board for the last year, and which hosted the SIDS Summit on NCDs, mental health, and climate change in 2023. Also a country that has continued to lean into South-South cooperation, particularly around pharmaceutical production and access to medicine, given our experience during COVID, when we were literally at the mercy of supply chains and border measures to access life-saving equipment. A country that has led the call for a reassessment of the global financial architecture to ensure more fairness and equity for vulnerable countries to be able to access climate change financing. A country that lives the reality of the link between NCDs and climate change, NCDs and mental health, NCDs and access to safe and healthy food. A country that recognizes the importance of investing in its healthcare institutions. But also a country that is on the front lines of the climate crisis, an existential crisis that touches every one of our citizens every single day. A country similar to all other small island developing states that has a rate of NCDs that is overwhelming given our population size and our resources. Barbados, like many other countries, was shaken by the financial crisis that hit the WHO and global health this year. Through chairing the executive board, we were in the middle of the storm. We saw the implications, we felt the implications, and we felt the weight on the management and staff in WHO who had to reassess, realign, and readjust in a matter of weeks. I want to give credit to Dr. Tedros and his team who handled this challenging process with grace and purpose. For a small country that relies on the WHO for data, intelligence, institutional strengthening, and for a number of programs, not least of which is NCDs and climate change, we were very worried, very worried. Because we cannot do any of this alone. We need the WHO, we need PAHO, and we need the multilateral community. Frankly, multilateralism for us is not a choice. It is part of our DNA as a country. So it was our priority to ensure that the WHO was able to navigate the choppy waters and to come out more resilient, more effective, and still with the most vulnerable countries and people at the heart of its work. The next few years will not be easy. Already we are seeing the resurgence of diseases we thought were long under control. And as you know, my Prime Minister, Mia Mottley, has been very much leading the charge on AMR, an issue that we're very concerned about given what we fully expect will be a future of further pandemics, but with less investment in antibiotics and research. I saw a statistic a few weeks ago that said Europe spends more on facial fillers than the world spends on research into emerging infectious diseases. Now, I have no issue with facial fillers, but can we let that statistic sit with us for a few seconds? Now, on NCDs, the figures in SIDS are staggering. SIDS have some of the highest rates of NCDs and overweight and obesity in the world and are among the most vulnerable to the effects of climate change. The challenges that we face are far greater than the resources that we have to deal with them. Over half of the deaths in SIDS are premature and from NCDs, including cardiovascular diseases, cancer, diabetes, chronic respiratory diseases, and mental health conditions. Nauru, Cook Islands, and Palau have the highest rates of obesity globally. Childhood obesity in SIDS is increasing exponentially. Global diabetes rates have doubled over the last 30 years, with middle-income and lower-income countries suffering the most. The highest prevalence of diabetes among adults in the world is also projected to be in SIDS, with diabetes prevalence in the Caribbean double the global average. The highest level of diabetes per capita are in the Pacific Islands, the Caribbean, Middle East, Pakistan, North Africa. The rate of hypertension is over 30% in almost all SIDS. In Guyana, premature mortality from cardiovascular disease is the highest in the region of the Americas. The top 4 countries with the highest premature mortality rates in the Americas are in the Caribbean: Guyana, Haiti, Belize, Suriname. And a 2023 WHO report shows that 8 of the 15 countries with more than 30% risk of premature death from cardiovascular disease, cancer, diabetes, or chronic respiratory disease are SIDS. Rates of mental health conditions reach as high as 15% in the Caribbean and the Pacific, where some SIDS still, unfortunately, criminalize suicide. So there's a need for more countries to update health legislation in line with human rights norms, including the decriminalization of suicide and the prohibition of coercive practices in the treatment of mental health conditions. The MCD epidemic grew faster in SIDS than elsewhere, partly due to commercial influence and trade challenges that can undermine access to fresh and nutritional food. For example, a recent study on the impact of the current tariff escalation that we're seeing today shows that grocery prices are likely to rise across the board by almost 3%, with the higher increases for fresh produce. This is not good news for countries that are already food insecure and who import almost all of their food. And we also know that 200 million people live with food insecurity, 200 people more than during the pandemic, than before the pandemic. I know this all sounds dire. We are still beautiful countries, come and visit. But this is the reality that we're dealing with. So Barbados was very, very honored to host the SIDS Ministerial Conference in June 2023, which was called Addressing the Triple Threat in Small Island Developing States: NCDs, Mental Health Conditions, and the Climate Crisis. And together with the former ambassador of Fiji, I co-led the drafting and the negotiation of the outcome document, which is called the Bridgetown Declaration on NCDs and Mental Health. And we really saw the Bridgetown Declaration as a critical input into the UN high-level meeting on NCDs, because it emphasizes the challenge of addressing NCDs and mental health conditions in the face of climate change and looks at the unique vulnerabilities of SIDS. The declaration calls for bold action across many fronts, including prevention and control of risk factors, management of conditions through primary health care, and addressing the links to climate change. But I have to be honest, I've been personally disappointed to see the lack of any real reference to this declaration and its impactful recommendations and call to action reflected in the zero draft for the September meeting. So my call to action to you is for you all to take a look at that declaration again or for the first time, so that in your planning and policies, whether at the level of the G7 or the G20, that you are fully seized of the priorities of those countries most affected by NCDs. It is a good return on investment to invest in addressing NCDs. Some are quick wins, and some are more long-term across political cycles. But protecting our people cannot be bound by electoral rounds. Here I reiterate the value of the WHO Best Buys and reaffirm that destigmatization and improved access to health literacy and services are critical to empower people to understand, prevent, and manage chronic conditions effectively. I want to close on 2 additional issues. Debt. G7 and G20 need to look closer at debt and debt relief as it relates to global health. I know the G7 outcome recognizes the need to promote debt sustainability, but 40% of the world now lives in places that spend more money paying interest on their debts than on health and education. In 2025, this cannot be morally correct. The number of African countries where debts have passed 60% of GDP has doubled in the past decade. We will not solve the health and NCD crisis unless we free up the resources to do it. Hence, addressing debt has to be a key pillar, including if we're going to look at building health systems and engaging in prevention, screening, and early detection. The adverse effects of climate change are increasingly pushing SIDS into unsustainable levels of debt. The fact that most of us are classified as middle-income or high-income countries makes it challenging to access international development assistance and concessional financing. This makes it challenging for us, the most vulnerable, to fund actions on preventing NCDs and mental health and to invest in universal health coverage. We need to address these global inconsistencies. We need to also have a recommitment to focused and transformative official development assistance. We cannot be beyond aid when there's so many vulnerable communities still existing. The second and final issue is the importance of lived experience when it comes to NCDs. Ultimately, this is all about people, communities, and individuals. One of the most powerful elements of the 2023 SIDS meeting in Barbados was that we highlighted civil society and individuals with lived experience and facilitated them to engage and participate in the decision-making process. Most premature deaths from NCDs and mental health conditions would be largely preventable if we had the health systems to respond to these individuals, and many of our countries do not have them. So here's my lived experience. So I'm a cancer survivor, and 10 years ago, I faced a diagnosis that millions of people around the world face. But I was here in Switzerland. I had access to a health system that operates on autopilot. The MRI machines were available, the chemotherapy was available, the testing was available, the aftercare support was available. I was lucky because I was diagnosed and treated in a country that had the means to invest in its health systems. Last year, someone very close to me was diagnosed with cancer. There was one working MRI machine in that country. She had life-saving surgery postponed 4 times because there was only one surgeon available in that country to provide that intervention. And the cost of medication was so prohibitive, she had to take out a loan. And she was still one of the lucky ones. So around this world are hundreds of thousands of people who look like me and you that are diagnosed with NCDs like cancer and diabetes, but who have no access to early treatment, early screening, medication, or machines. So as we speak about policies and a new architecture for global health, we must put people in the middle of our policies, especially the most vulnerable people. And we must make these policies with those with the lived experience at the center. Thank you very much.